A new analysis that looked at coronavirus testing levels found that 60% of states do not have sufficient tests readily available.
And with many states relaxing their lockdowns, low testing levels could lead to undetected cases and even larger outbreaks. So coming in is our chief health editor, Dr. Nandi, to tell us more about this new analysis. Dr. Nandi.
So Glenda, this analysis was conducted by the Associated Press, and the data was pulled by the COVID tracking project that collects and publishes the number of tests processed daily in all 50 states. And what the analysis found out, Glenda, was that only 40% of states could actually test 2% of the population. Now, health officials have recently said that every state would get enough tests so that 2.6% of the population could be tested for COVID-19. But unfortunately, guess what? This has not happened yet. And to me, this is concerning when you look at many states like Georgia, Texas, Florida, Colorado, and South Carolina that have not met this testing threshold and are opening or planning to open businesses pretty quickly here.
So, Doc, just looking at the numbers here, 2.6% seems like that's just too low of a percentage when it comes to actually testing people. What do you think about that?
I totally agree with you, Alan, and so do many other health experts. We really shouldn't limit testing to 2.6%. Well, that might be fine for some states with lower populations. It won't be enough for the states with higher populations. And I really feel that testing should be given to whoever feels like they may have COVID-19 and want to get tested. That way, we can effectively know and monitor those who have the coronavirus, and that helps us contain the spread of this very contagious disease. And if we can't contain it, unfortunately, the hospitals could get overwhelmed again, and this may lead to some states, again, to go back to being shut down like we were.
So, Doc, let's talk about some good news. How might that treatment, remdesivir, and a possible vaccine play into all of this?
Absolutely good news indeed. Remdesivir is an intravenous antiviral medication that I talked about. It was recently granted emergency use authorization by the FDA. It's really not a cure, but it's shown to boost recovery for those with COVID-19. In fact, it's shown that it can shorten recovery time for hospitalized patients by 31%. And on average, here's the good news, patients were able to leave the hospitals 4 days sooner. Now, as far as for a vaccine, it's possible that we may have one ready by January, according to a very, very good source, which is the nation's top infectious disease expert, Dr. Anthony Fauci. Now, this is being called, quote unquote, Operation Warp Speed. And the plan is to have 100 million doses of the vaccine ready, by 100 million doses of the vaccine available by November, and then 200 million by December, followed by 300 million doses by January. But before we get super excited about the news, we must first have a safe and effective vaccine ready to go, which we don't have yet. However, the White House's coronavirus vaccine project has identified 14 vaccines that they like to focus on, with hopes that 3 or 4 of them will be successful. So yes, this is great news, but we still have many months ahead of us. So it's really imperative for us to do what we've been doing all this time, to practice prevention techniques to help keep us safe. Hand washing, disinfecting, wearing masks, and social distancing. This will keep the virus levels low until we can get the vaccine or treatment that we need. And that's how we defeat the coronavirus, in my opinion.
And I know a lot of people are really pushing for a vaccine and a treatment as well. Doc, thank you so much for that information.
My pleasure.
Thank you, Dr. Nandi. 7 Action News is taking action every step of the way of this crisis. Coming up ahead at 6, keeping kids ahead at school, the delays for Detroit students, and how long some may need to wait to get their work done. Plus, the Rebound Detroit, stimulus cash for the dead, what you should do if you got a check in the mail for your loved one who has passed on. Plus, you can find out more information on our website, WXYZ.com. We are monitoring when the state will update the latest numbers in Michigan, and we'll let you know the moment that happens online.